Most seniors don't realize this, but heart failure doesn't happen overnight. It often begins silently, with small warning signs that people over 60 brush off as just aging. But ignoring these signals can be dangerous. Right now, more than 6 million Americans are living with heart failure. And many only find out after an emergency, a hospital visit, sudden shortness of breath, or chest pain. The truth is, your body often whispers before it screams. Subtle symptoms like fatigue, swelling in your ankles, or even a persistent cough can all be early warnings of heart failure. Doctors see it every day. Patients come in thinking it's nothing serious, when in fact, their heart is already struggling. Today, I'll reveal 10 hidden signs of heart failure that seniors must notice. Some of them may surprise you. They aren't the classic chest pain you might expect. I'll also explain why these symptoms appear, what's happening inside your heart, and how to respond before it's too late. Because if you know what to look for, you can act early, protect your heart, and add years of healthier life. Let's dive in. Number 10. Persistent fatigue. One of the earliest and most overlooked signs of heart failure is persistent fatigue. Many seniors assume that being tired is just a natural part of getting older, but the kind of fatigue linked to heart problems is very different from ordinary tiredness. When your heart begins to weaken, it can't pump enough blood to supply your muscles and organs with oxygen. As a result, even small tasks, walking across the room, climbing a few steps, or doing light chores around the house, leave you feeling drained. Sometimes to the point where you need to sit down and rest. This exhaustion doesn't disappear after a nap or a good night's sleep. It lingers, following you throughout the day, and often feels disproportionate to the activity that caused it. Doctors describe this as one of the most common early red flags they see, but it's also the one most patients ignore. Research shows that up to 80% of people later diagnosed with heart failure had been experiencing unusual fatigue long before their diagnosis, yet they explained it away as aging, stress, or poor sleep. Seniors often adapt their lifestyle without realizing it, cutting back on walks, avoiding stairs, or asking for more help around the house, not because they consciously decided to, but because their energy is quietly disappearing. This creeping exhaustion is your body's way of whispering that the heart is struggling. Unlike normal tiredness, which improves with rest, this type of fatigue persists, sometimes getting worse over weeks or months. And it can be subtle. You might notice yourself sitting down more often, skipping activities you once enjoyed, or waking up still tired despite going to bed early. Many patients recall that fatigue was the very first change they noticed, long before any shortness of breath or chest pain. Number 9. Swelling in the ankles and feet. Another hidden sign of heart failure that seniors often dismiss is swelling in the ankles, feet, or lower legs. At first glance, it looks harmless. Maybe you think it's just from standing too long, sitting in a chair, or eating something salty. But when the heart begins to fail, it doesn't pump blood effectively, and fluid starts to build up in the tissues. Doctors call this edema, and it's one of the clearest early warnings that the cardiovascular system is under strain. For many seniors, the swelling is subtle at first. Shoes feel tighter at the end of the day. Socks leave deeper marks on the skin, or the ankles look puffy in the evening. Over time, the swelling becomes more noticeable, sometimes so pronounced that it makes walking uncomfortable. This isn't just cosmetic or age-related puffiness. Fluid retention linked to heart failure is caused by rising pressure inside the veins. As the weakened heart struggles to push blood forward, the body reacts by holding on to sodium and water, which makes the swelling even worse. What's important is that the swelling is often symmetrical, affecting both feet or both ankles, and it doesn't fully go away with simple rest. Seniors who prop up their feet at night might notice some improvement in the morning, but the puffiness often returns quickly during the day. In studies, Doctors have found that many patients with undiagnosed heart failure had been experiencing this kind of swelling for months or even years, but they attributed it to arthritis, weight gain, or poor circulation. Unfortunately, by the time they sought medical attention, the swelling was a clear indicator that the heart was already struggling. It's a classic case of the body giving an early signal that something deeper is wrong, and too often it's ignored until it becomes severe. Number 8. Shortness of breath during routine activities. One of the most alarming but often overlooked signs of early heart failure is shortness of breath, even during light activity. Seniors sometimes chalk it up to being out of shape or just getting older. But when you find yourself breathing harder than usual after climbing a few stairs, carrying groceries, or even walking at a normal pace, it can signal something much more serious. In heart failure, the weakened heart muscle can't pump blood efficiently, causing fluid to back up into the lungs. This makes it harder for oxygen to move from the air you breathe into your bloodstream, leaving you gasping for air with activities that once felt easy. This symptom tends to creep in slowly. At first, you might notice that you pause more often during walks or that you avoid hills or stairs without even realizing why. Some people describe it as a heavy, suffocating feeling in the chest, while others simply say, "I just can't catch my breath." Over time, the shortness of breath may appear even at rest, especially when lying flat. Many seniors notice they need extra pillows to sleep comfortably because lying down makes it harder to breathe, a condition known as orthopnea. In more advanced cases, people wake up in the middle of the night gasping for air, which is a frightening and dangerous sign. Medical studies consistently show that unexplained shortness of breath is one of the earliest predictors of heart failure progression. Yet, because it can also overlap with other conditions like asthma or lung problems, many patients delay seeking care. This delay can be costly, as by the time shortness of breath becomes obvious, the heart has already been under strain for months. Doctors often emphasize that seniors should never ignore changes in breathing patterns, especially if they happen alongside other subtle symptoms like fatigue or swelling. Number 7. Frequent nighttime urination. Another hidden warning sign of heart failure that seniors often overlook is the need to urinate more often during the night. It may seem unrelated to the heart, and many people assume it's just part of aging or an issue with the bladder or prostate. But in reality, this can be a direct consequence of a weakened heart. When the heart struggles to pump blood effectively during the day, fluid tends to accumulate in the lower body, in the ankles, feet, and legs. Then, when you lie down to sleep, gravity shifts, and that fluid is reabsorbed into the bloodstream. The kidneys suddenly receive a surge of fluid to filter, which triggers frequent trips to the bathroom at night, a condition doctors call nocturia. At first, seniors might only notice waking up once or twice during the night. But as heart failure progresses, the pattern becomes more disruptive, sometimes every hour or two, leaving you exhausted the next morning. This creates a vicious cycle. The heart is already under stress, and now the body isn't getting the restorative sleep it needs. Many older adults I've spoken with describe it as never feeling rested because the constant waking wears them down over weeks and months. What's most concerning is that they rarely connect this bathroom pattern to their heart. Instead, they blame it on age, diet, or urology issues. While the underlying heart failure quietly worsens, medical research has confirmed that nocturia is a surprisingly common symptom in patients with early heart failure. In fact, some cardiologists even ask specifically about nighttime urination during exams, because it often appears before more obvious warning signs. When this symptom combines with swelling in the legs or shortness of breath, it paints a very clear picture that the heart is struggling. Yet many seniors never bring it up to their doctor, assuming it's embarrassing or unimportant. That silence can delay diagnosis and treatment. Number 6. persistent cough or wheezing, a chronic cough that doesn't go away, or a wheezing sound when you breathe can be another hidden sign of heart failure. Most seniors immediately think of lung problems, asthma, or even seasonal allergies. But the heart can actually be the source of this symptom. When the heart becomes too weak to pump blood efficiently, fluid begins to build up in the lungs. This fluid irritates the airways, triggering a cough that is often worse at night or when lying flat. Some people describe it as a nagging, dry cough that lingers for weeks, while others experience coughing fits that bring up frothy or pink-tinged mucus, a serious red flag that the lungs are congested with fluid. Doctors call this cardiac cough, and it's one of those symptoms that gets misdiagnosed often. Seniors may spend months treating it with cough syrups, inhalers, or antibiotics. But the cough persists because the root cause isn't the lungs themselves, it's the struggling heart. Wheezing, that high-pitched whistling sound when exhaling, can also appear as fluid presses on the airways, narrowing them and making breathing more difficult. Unlike a regular cold or bronchitis, this kind of cough doesn't fully improve with typical treatments and tends to come back again and again. Especially at night, research shows that many people with undiagnosed heart failure were living with this persistent cough for months before their condition was identified. In hindsight, it was one of the earliest and most telling signs that the heart could no longer keep up. What makes this symptom especially dangerous is that it overlaps with so many common conditions, which means it often gets brushed aside until the situation becomes critical. Seniors who notice a cough that lingers longer than 3 weeks, especially if it gets worse when lying down or is paired with shortness of breath, should see it as a potential warning that the heart needs attention. Number 5. Rapid or irregular heartbeat. Another sign of developing heart failure that often slips under the radar is a rapid or irregular heartbeat. Many seniors describe it as the heart fluttering, racing, or skipping beats, even when they're just sitting quietly. This happens because as the heart weakens, it struggles to pump blood efficiently. To compensate, it often speeds up or falls into an irregular rhythm, a condition doctors call arrhythmia. While a few skipped beats here and there may not seem alarming, when this pattern becomes frequent, it can signal that the heart's electrical system is under stress and no longer maintaining a steady rhythm. Seniors often dismiss this as anxiety, stress, or simply being worked up, but the difference lies in how unpredictable and persistent these episodes are. Some notice their pulse pounding in the chest or neck, while others feel lightheaded, dizzy, or unusually weak during the episodes. In some cases, the heartbeat suddenly accelerates for no clear reason, even while resting. Medical research shows that arrhythmias are common in early heart failure, and they can increase the risk of dangerous complications like stroke or sudden cardiac arrest if left untreated. What makes this symptom particularly dangerous is how easy it is to ignore or excuse. Seniors may not always feel the irregular rhythm directly, but may notice its consequences: unexplained fatigue, faintness, or difficulty concentrating. Others only discover it when their doctor listens to the heart or runs an electrocardiogram. Unfortunately, because irregular heartbeats can come and go, many people delay seeking help, thinking it's just nerves or dehydration. But in reality, it's the body's way of signaling that the heart is under real strain. Number 4. Sudden weight gain from fluid retention. A surprising but very telling sign of heart failure is sudden weight gain that can't be explained by diet or lifestyle changes. Seniors often assume they've gained a few extra pounds because they ate more, moved less, or simply because of aging metabolism. But when the heart begins to fail, the body starts holding onto fluid instead of properly circulating it. This extra fluid can cause rapid weight gain, sometimes 2, 3, or even 5 pounds within just a few days. Unlike gradual weight changes, which are normal over time, this type of gain happens quickly and is directly linked to fluid building up inside the body. Doctors frequently warn their heart patients to monitor their weight daily for this very reason. An unexpected jump in weight is often one of the earliest signs that the heart is struggling. This fluid retention usually accompanies other symptoms, like swelling in the ankles, bloating in the stomach, or a feeling of heaviness in the body. Seniors might notice their clothes or rings fitting tighter, or that they suddenly feel more sluggish, even if their diet hasn't changed. Some describe it as feeling puffy all over, but they don't always realize it's their heart driving the change. Medical studies confirm that weight gain from fluid retention is a classic early red flag for worsening heart failure. In fact, many cardiologists use it as a key indicator to adjust treatment. Unfortunately, most people don't weigh themselves regularly, especially older adults who assume small fluctuations are meaningless. But ignoring these changes can allow the condition to progress unnoticed. What looks like a simple number on the scale is often the body's warning that the heart is under serious pressure. Number 3. Loss of appetite and nausea. One of the less obvious but very significant hidden signs of heart failure is a sudden loss of appetite, sometimes accompanied by nausea or a constant feeling of fullness. Seniors often dismiss this as slowing digestion with age, but in reality, it can be the result of the heart's reduced pumping ability. When the heart weakens, blood flow to the digestive organs decreases, while fluid begins to build up in the abdomen. This combination can make eating uncomfortable, leaving you feeling bloated even after small meals. Some patients describe it as if the stomach has no room for food, while others say they start eating but quickly feel nauseated or lose interest altogether. This change in eating habits doesn't just affect comfort, it can have serious consequences. Seniors who eat less because of nausea or fullness begin to lose weight, but unlike healthy weight loss, this is actually muscle loss and malnutrition. Doctors frequently notice that patients with heart failure appear thinner in the arms and shoulders while still carrying extra fluid in the abdomen or legs. It's a deceptive picture. Weight might stay the same or even increase, but nutrition and muscle strength are quietly deteriorating. Studies have shown that reduced appetite and digestive discomfort are surprisingly common among people with heart failure. Yet many don't recognize the connection until much later. Because the symptom feels more like a stomach issue, patients often spend time treating indigestion, reflux, or gallbladder problems, while the true cause, the struggling heart, goes unaddressed. By the time they reach a cardiologist, their weakened nutrition has already made recovery harder. What seems like a minor change in appetite can actually be the body's warning that the heart is failing to keep up with the body's basic needs. Number 2. Confusion, memory problems, or difficulty concentrating. One of the most surprising hidden signs of heart failure in seniors is a sudden change in mental sharpness. People often think of heart failure as only affecting the chest, lungs, or circulation. But the brain is one of the first organs to suffer when the heart can't pump blood efficiently. Reduced blood flow means less oxygen reaching brain cells. And this can cause confusion, short-term memory problems, or a noticeable difficulty focusing on tasks that once felt simple. Seniors sometimes describe it as a foggy feeling, where conversations are harder to follow, or they forget details they would normally recall without effort. What makes this symptom tricky is that it's often blamed on normal aging or even early dementia. Families might notice their loved one repeating themselves, losing track of time, or struggling with decisions, and assume it's just cognitive decline. But in many cases, these changes are actually related to the heart struggling to circulate enough oxygen-rich blood to the brain. Doctors point out that cognitive symptoms often appear alongside other early signs like fatigue, shortness of breath, or swelling, forming a pattern that strongly suggests heart failure rather than standalone memory problems. Medical research backs this up. Studies have found that seniors with untreated heart failure are more likely to develop cognitive decline, And in some cases, mental sharpness improves once the heart is treated and circulation stabilizes. This shows just how deeply connected the heart and brain are. Unfortunately, many patients don't seek help until these symptoms have already disrupted their independence, forgetting medications, missing appointments, or feeling unsafe doing everyday activities. Recognizing confusion or brain fog as a possible sign of heart failure, rather than dismissing it as old age, can make the difference between early intervention and a late, dangerous diagnosis. Number 1. Chest pain or pressure. The most serious and alarming hidden sign of heart failure is chest pain or pressure that doesn't go away. Seniors often describe it not as a sharp stab, but as a heavy, squeezing, or burning sensation in the chest, sometimes spreading into the shoulders, arms, neck, or jaw. This pressure is a sign that the heart muscle itself is struggling for oxygen. While some people mistake it for heartburn or indigestion, true cardiac chest discomfort often feels more intense and comes with other symptoms like shortness of breath, sweating, or sudden weakness. Unlike minor pains that fade quickly, this kind of pressure lingers or returns repeatedly, especially during physical activity or emotional stress. Doctors treat chest pain as one of the most urgent red flags, because it can mean the heart is not receiving enough blood and is at risk of serious damage. In the context of developing heart failure, it signals that the heart is under extreme strain and that circulation is already compromised. Studies have shown that many seniors experiencing early chest discomfort waited days or weeks before seeking help, thinking it was just indigestion or muscle strain. Unfortunately, this delay often leads to hospitalization or sudden cardiac events. What makes chest pain so dangerous as a symptom is that it can appear late in the progression, after other subtle warnings like fatigue or swelling have already been present for months. By the time the chest feels heavy, the heart is often at a breaking point. That's why experts urge seniors never to ignore or self-diagnose chest discomfort. Even if it turns out to be something less severe, getting checked immediately can prevent irreversible damage. When the chest sends this warning, it is the body's way of saying, the heart needs urgent attention, and waiting is not an option. We've just uncovered 10 hidden signs of heart failure that seniors must notice. From persistent fatigue and swelling in the ankles to confusion, memory problems, and finally, the most urgent warning of all, chest pain or pressure. What makes these symptoms so dangerous is how easy they are to dismiss. Most people chalk them up to aging, stress, or minor health issues, while in reality, the heart is quietly struggling to keep up. And by the time the signs become undeniable, the condition is already advanced. But here's the hopeful truth. Recognizing these red flags early can change everything. Studies show that seniors who catch heart failure in its early stages live longer, healthier, and more independent lives. Something as simple as paying attention to unusual fatigue, monitoring daily weight, or noticing swelling in the feet can give doctors the information they need to act before the situation turns critical. And it's not just about medication or hospital visits. It's about protecting your quality of life, staying active, and enjoying time with family without constant health fears. Your body always sends signals. The challenge is whether you choose to listen. Don't brush off breathlessness. Don't ignore sudden weight gain, and never ever assume chest discomfort is just nothing. If you or someone you love over 60 is experiencing these symptoms, take them seriously. Have the conversation with your doctor, even if it feels inconvenient or unnecessary, because one appointment today could save years of healthy life tomorrow. Now, I want to hear from you. Have you or someone in your family noticed these subtle symptoms before? Did you connect them to the heart, or did it come as a surprise later? Share your story in the comments below, because your experience could help someone else recognize the warning signs in time. And if this video opened your eyes, don't forget To subscribe, we have more essential health tips for seniors coming up. Remember, your heart doesn't just keep you alive, it keeps you living. Take care of it, and it will take care of you.